You know, I've had my share of aches and pains over the years, but nothing worried me more than the day my knee gave out. I was 67, just coming down the stairs with a laundry basket, and my left knee just buckled. No warning, no fall, just a sudden sharp pain right under the kneecap that dropped me to the floor. I sat there on the stairs for 10 minutes trying to figure out what happened. The next day, I went to an orthopedic surgeon, a very nice man in a very nice office with a very nice plaque on the wall. He took one x-ray, pushed on my knee a few times, and said, "You've got patellofemoral pain. The cartilage under your kneecap is wearing out. You're going to need a scope, arthroscopic surgery." $8,000 after insurance. I asked him, "Is there anything else I can try first?" He shrugged and said, "You can try physical therapy, but it won't fix the structure." So I went home, got on the internet, and started digging. And what I found made me so angry I almost threw my computer out the window. Because the whole problem, my wobbly knee, the pain going downstairs, the aching after sitting too long, it wasn't a cartilage problem. It was a muscle problem. And I fixed it in 1 week with a $1 strap from the dollar store. Surgeons have tried to get this video removed 4 times. They don't want you seeing this, because if you can fix your own knee for $1, they lose an $8,000 surgery. Let me describe that knee pain, because I know a lot of you are nodding your heads right now. It's not a sharp pain on the side of your knee. That's usually a ligament. It's a dull, grinding ache right behind or around your kneecap. It hurts when you go downstairs, not up. It hurts when you sit in a movie theater for too long and then stand up. That's called theater sign. It might even pop or crack when you straighten it. And the surgeon will show you an x-ray and say, "See this? The cartilage is worn. You're bone on bone." And he'll tell you that the only fix is to go in with a camera, clean it out, maybe shave the back of the kneecap. I had 2 friends who had that surgery. Both of them said it helped for a few months, and then the pain came back. One of them ended up with a knee replacement 5 years later. That's when I started asking questions. Now here's what the surgeons don't tell you. The kneecap, the patella, it's not attached to anything solid. It's a floating bone, like a little pulley. And it's supposed to slide up and down in a groove at the end of your thigh bone. When that groove is centered, everything works fine. But if your kneecap is being pulled off center, either to the outside or inside, it starts grinding against the edge of the groove. That's what causes the pain, the popping, the wearing down of cartilage. And what controls the position of the kneecap? Muscles. Specifically, there's a little teardrop-shaped muscle on the inside of your thigh called the vastus medialis oblique, the VMO for short. That muscle is the only thing that keeps your kneecap tracking straight. If that muscle is weak, your kneecap drifts outward, grinds against the bone, and hurts. The surgeons will scope your knee, shave off the frayed cartilage, but they don't fix the muscle, so the pain comes back, and they get to do another surgery. That's the business model. And there's a second muscle that's even more important, and this is the part they really don't want you to know. The gluteus medius, one of the muscles in your hip. When that muscle is weak, your thigh rotates inward as you walk. That inward rotation pulls the kneecap off its track. So the real cause of most anterior knee pain isn't the knee at all. It's the hip. Weak hips cause the knee to collapse inward, and that misalignment grinds down the cartilage. Physical therapists know this. Good trainers know this. But orthopedic surgeons, they're not in the business of fixing weak hips. They're in the business of cutting. And the whole system is set up so you see the surgeon first, get the scary diagnosis, and schedule the surgery before anyone ever checks your glutes or your VMO. I'm not a doctor, but I've been studying my own body for 70 years. And I found out that the exercises to fix this are so simple they're almost embarrassing. You don't need a gym. You don't need a physical therapist. You need a $1 resistance band, the kind you can buy at any dollar store, the stretchy rubber strap about 4 feet long. And you need 5 minutes a day. I did these 3 exercises every day for 1 week. And on the 7th day, I walked down the stairs without grabbing the railing for the first time in 2 years. My wife asked me what I did. I said, I spent $1 and stopped listening to surgeons. Let me show you exactly what I do now. I do this routine every morning while I'm waiting for my coffee. It takes 5 minutes, and it's kept my knees pain-free for 8 years. The first exercise is what I call the terminal knee extension. You're going to sit on a chair with your back straight. Take your resistance band and loop it around the leg of the chair or a heavy table leg. Then put the other end around the back of your ankle, just above your heel. Straighten your leg against the band. But here's the trick. You don't lock your knee. You straighten it until it's almost fully extended, and you squeeze your thigh muscle, the teardrop on the inside of your knee, as hard as you can. Hold that squeeze for 3 seconds, then lower slowly. That's 1 rep. Do 15 on each leg. This exercise targets that VMO muscle directly. Most people do leg extensions on machines, and they lock their knee, which puts pressure on the joint. This band version lets you strengthen the muscle without stressing the cartilage. I felt the difference in 3 days. The second exercise is the clamshell. This one targets the gluteus medius, the hip muscle that keeps your knee from caving in. Lie on your side with your knees bent at about a 45-degree angle, your hips stacked one on top of the other. Loop the resistance band around both legs, just above your knees, keeping your feet touching. Open your top knee like a clamshell, lifting against the band. You want to feel it in your hip, not your lower back. Do 15 on each side. When I first tried this, I could barely lift my knee an inch. After a week, I could open it 6 inches. That's how weak my hips had gotten from sitting in a chair all day. And that weakness was pulling my kneecap off its track. The third exercise is the side leg lift. Still lying on your side, keep your legs straight and stacked. Loop the band around your ankles. Lift your top leg straight up, keeping your hips still. Don't let your hip roll back. Keep your body in a straight line. Lift until you feel your hip muscle engage. Then lower slowly. 15 on each side. This strengthens the entire lateral hip musculature. When this muscle is strong, it prevents your knee from drifting inward when you walk, run, or go downstairs. That's the whole routine. 15 reps of terminal knee extension on each leg, 15 clamshells on each side, 15 side leg lifts on each side. 5 minutes a day. Do it every day for a week, and I promise you, your knee will feel different. Do it for a month, and the pain that's been bothering you for years will be gone. Now, I know some of you are thinking, but my doctor said I have arthritis. He said there's no cure for arthritis. Let me tell you something about that word. Arthritis just means joint inflammation. It's a description, not a diagnosis. Most people over 50 have some wear and tear in their knees. It shows up on X-ray as a little narrowing of the joint space. But here's what the research shows, and the surgeons don't like to mention this. The amount of wear on an X-ray has almost nothing to do with how much pain you feel. I've seen people with terrible X-rays who have no pain, and people with clean X-rays who can't walk. Because pain comes from alignment, from muscles pulling things out of place, from the kneecap grinding where it shouldn't. Fix the alignment, fix the muscle weakness, and the pain goes away, even if the X-ray still looks the same. But you can't make $8,000 telling someone to do clamshells with a dollar band. Let me tell you about my neighbor, Eddie. Eddie's a retired electrician, 71 years old. He was scheduled for knee surgery, scope and clean out, on his right knee. He had the pain going downstairs, the theater sign, everything. I showed him the band exercises. He said, "My surgeon says the cartilage is worn. This isn't going to do anything." I said, "Eddie, Humor me. Do these 3 things for a week. If it doesn't work, go ahead with the surgery. He did them for 5 days. On the 6th day, he called me and said, I'm not having the surgery. I asked why. He said, because yesterday I went down my basement stairs without holding the railing for the first time in 3 years. He canceled his surgery, saved $8,000, and now he does the exercises every morning. That was 6 years ago. He still hasn't had that surgery. His wife says he's been dancing at weddings again. I've shown this routine to 31 people at the VFW hall. 29 of them said their knee pain dropped from a 6 or 7 to a 1 or 2 within 2 weeks. One guy, Ralph, he was using a cane because of his knee. 2 weeks after starting the band exercises, he walked into the hall without the cane. He left it in his truck. He said, I'm keeping it there just in case. He never used it again. Now, I have to be honest with you. This doesn't work for every knee problem. If you have a torn meniscus that's locked your knee, meaning you can't straighten it, you need to see a doctor. If you have a sudden traumatic injury from a fall, get it checked. If you have a knee that's hot, red, and swollen like a balloon, that could be an infection or gout, and you need real treatment. But for the vast majority of you, the ones with that dull, aching, going downstairs hurts kind of pain, this is the safest thing you can try. You're strengthening muscles. You're not doing anything dangerous. The worst that happens is you waste 5 minutes a day and $1 on a band. Let me go through the steps one more time, because I know some of you are going to want to start today. Exercise 1, terminal knee extension. Sit on a chair. Loop the band around a table leg or chair leg and around the back of your ankle. Straighten your leg until it's almost fully extended, but don't lock the knee. Squeeze your inner thigh muscle, the teardrop above your kneecap, as hard as you can. Hold for 3 seconds, lower slowly, 15 reps. Switch legs. Exercise 2, clamshell. Lie on your side with knees bent. Loop the band just above your knees. Keeping your feet together, open your top knee like a clam. Don't let your hips roll back. Squeeze your glute at the top. Lower slowly. 15 reps. Switch sides. Exercise 3, side leg lift. Lie on your side with legs straight. Loop the band around your ankles. Lift your top leg straight up, keeping your body in a line. Don't let your hips tilt. Lower slowly. 15 reps. Switch sides. That's it. 5 minutes. Do this every day for 1 week, and I want you to walk down a flight of stairs afterward. You'll be amazed. Now, I want to tell you about something that happened to me last year. I was at my grandson's soccer game, and I saw a woman struggling to get up from the bleachers. She was maybe 60, but her knees were so bad she had to use both hands to push herself up. She saw me walking around without any trouble and asked, "How do you do it?" I told her about the band. She said, "My surgeon says I need both knees replaced." I said, "Before you do that, try these exercises for 2 weeks." I gave her a band I had in my truck. 2 weeks later, she called me and said she was going down her basement stairs without the railing. She canceled her consultation with the surgeon. She told me, "You saved me $60,000. I told her, "No, I saved you a band." That's the part that makes me so angry about the medical industry. They have you convinced that your body is broken, that you need expensive interventions, that the only solution is surgery or drugs or custom orthotics. But so much of what we call aging is just muscle weakness and bad alignment. And the fix is not a knife. It's movement. It's strengthening the muscles that hold us together. And the people who know this, the good physical therapists, the old school trainers, they're not the ones making the money. The money is in the surgery, the implants, the endless follow-up visits. So they steer you toward the surgeon first. They make you afraid of your own knees. And they pray you never find out that a dollar band can do what their $8,000 scope was supposed to do. I've had people ask me, should I do these exercises if I already had knee surgery? Absolutely. In fact, this is exactly what a good physical therapist would give you after surgery, if you get a good one. But a lot of times, they rush you through a few sessions and send you home with a photocopied sheet. You have to be consistent. 5 minutes a day, every day. Not once a week, not when you remember. Every single day. That's how you rebuild the muscle. That's how you keep the pain away. I do these exercises now, not because my knee hurts. It doesn't, but because I never want it to hurt again. I'm 79 years old, and I can still go downstairs 2 at a time. I can get up off the floor without using my hands. I can walk my dog for 2 miles without a twinge. And it's not because I have good genes. My father had terrible knees. It's because I took responsibility for my own body and stopped trusting the system that wanted to cut me open. If this video made a difference for you, I want you to do 3 things. First, go to the dollar store and buy a resistance band. They're usually hanging near the exercise stuff. $1. Second, do these 3 exercises tonight and every morning for a week. And third, share this video with someone you know who's been told they need knee surgery. They might be scared. They might be in pain. They might be about to spend thousands of dollars on something they don't need. You could save them a lot of misery. And hit that subscribe button, because every subscription tells YouTube that this kind of information should exist. The surgeons have already tried to flag this video twice. They don't like people finding out that a $1 strap can replace an $8,000 operation. If this video disappears, you'll know why. And if you have that shooting pain down your leg, the sciatica I talked about in my last video, click the video on your screen right now. That $1 towel trick got banned in 3 states. Physical therapists hate that one even more than this one. And if you have heel pain, the plantar fasciitis that feels like a nail in your foot, I've got a video on that too, using nothing but a sock. That one's right there on the screen. I'm too old to care about being popular. I just care about being useful. Now go get a band, sit on the floor, do 15 clamshells, and in 1 week, when you walk down your stairs without pain, you'll thank me. I'll see you in the next one.